Hello, everybody. This is Dr. Osborne, and welcome to today's episode of Pick Dr. Osborne's Brain. And super excited to talk about this topic. We've had a lot of you writing in about this particular topic with tons of questions. So I wanted to really cover it in grand fashion for you on a live stream. So here we are. So today we're going to be talking about sleep. Now let's do a little bit of housekeeping before we jump into this live cast here. I want to make sure that everybody is seeing me and everybody can hear me. So I'm going to give a minute for everybody who's on to chime in, make sure that you're hearing me, make sure that you're seeing me. And once we start getting that feedback from you, we will dive right into the content. So again, if you can hear me, if you can see me, chime right into your box there on your chat and just let me know. All right, looks like I am coming through and we are ready to get started. So again, today's topic, Pick Dr. Osborne's Brain, is all about sleep. And so we're going to be jumping into that. A lot of you are already chiming in with really great questions. And again, we're going to get to those, but I've got some exciting announcements to make today as well. The first one, check this out. This is really cool. We got featured, No Grain, No Pain, just got featured in Natural Grocers. So Natural Grocers is like the competition to Whole Foods across the country. They run a really great grocery store chain, and they picked up copies of No Grain, No Pain to carry in their stores and featured our book and in their most recent mail out. This was pretty cool. Somebody sent this to me. And anyway, it's always exciting to see the message is getting out. The other big announcement is that, those of you who don't already know, No Grain, No Pain was picked up by PBS. So we ran and produced a TV special, and they're getting ready to air it again for summer. It's actually already been aired. It was aired in the spring. But for those of you who didn't check it out or didn't even know it existed, you'll be able to check it out hopefully again this summer. As soon as we get some show and air dates, I'll let you know. I'll be the first one to let you know. So wanted to share that with you. I'm super excited about it. Again, anytime we can get the message out and the word out about diet change to help people get better, that's exciting to me. So, all right, let's dive into why can't I sleep? Like, what is it that prevents sleep, and why is sleep so important? So let's just talk first about some basic sleep stuff. Sleep basics, if you will. Fundamentally speaking, humans need to sleep, obviously, to heal and repair and to recharge their batteries, their internal batteries. So the first element is there's a timing for sleep, and a lot of people, their timing is off. The timing for sleep, when does research say that we heal and repair the most and the best? Research shows us that, hang on just a second here. I'm getting some people chiming in saying they have no sound, but I'm getting other people that say they do. So you're not going to be able to hear me. If you can't hear me, you can't hear me, but you might want to refresh your screen. So at any rate, 10 p.m. to 2 a.m. If we look at, kind of what research shows us as to what is the most effective element for sleep, it's 10 p.m. to 2 a.m. That means being asleep between 10 and 2, not being I'm getting in bed at 10 and falling asleep at 11, and then, waking up at 1 and then going back to sleep, right? So we want to be asleep during that 10 p.m. to 2 a.m. time frame. And obviously we want to be asleep longer on both ends of that spectrum. So, ultimately, if we look at human evolution as a standard of what time sleep is ideal, it's when the sun goes down. No human that I know has infravision where they can see in the dark. And so, we're not adapted or evolved for nighttime vision. And so when the sun goes down, typically that's the point at which our melatonin levels are highest in our brain. Melatonin is the hormone that puts our brain to sleep. And a lot of you are asking about serotonin and 5-HTP. We're going to talk about that and tie that in just a minute. But melatonin is peaked out. It's peaking out as the sun goes down, And so that's what puts our brain to sleep. It's what shuts down the cortical activating system in the brain and puts us to sleep and allows us to stay asleep. The ideal time to wake up is when the sun comes through the window or when the sun shines and wakes you up. Now that's ideal, and I know that not everybody lives in an ideal world and not everybody has, access to that ideal environment, although we want to try to mimic that or emulate that as much as we possibly can. So 10 p.m. to 2 a.m. is when you need to be asleep, but I would recommend that you be asleep on the earlier side and then obviously sleeping later than just till 2 a.m. But most humans require, depending on what you're doing in your life, most humans require anywhere from 5 to 12 hours of sleep a day. And now that's a big difference. That's a big range, right? Some people don't need as much sleep. That's actually been proven. Some people need a lot more sleep. And a lot of that depends on what you're doing in your life. If you're suffering with an autoimmune condition or if you're suffering with a chronic inflammatory condition, sleep becomes more important because it's part of how your body regulates the healing process, and you've got a lot to heal from. If you're training and working out really hard, you're going to need more sleep to recover from that extra work or that extra exercise. So there are times where we need more sleep, times where we need less sleep. And so certainly, we have to take that into account as well. It's a very individualized component, but most people do best in between 6 and 8 hours of sleep or more each night, especially those of you who are struggling with health issues. It's very, very important that you get adequate sleep. I would recommend more on the side of 8 hours plus a night, but also even considering intermittent naps throughout the day. Now, I want to back up because there's one caveat to sleep that a lot of people don't think about, but and then because we're talking about people with sleep trouble, I want to point this caveat out. Some people struggle getting to sleep or staying asleep at night because their mind wakes them up. Their mind is trying to process. So I see this particularly in people who are troubled, people who are going through periods of intense stress. Maybe they lost their job. Maybe maybe there's something going on at home that's keeping their mind spinning. Maybe there's a family member who's sick that's keeping their mind spinning. Okay, we should be back up. So sorry about that. Sometimes technological glitches. We've had some internet blips today. But again, sometimes people's minds are processing, and it's important for their mind to process. And so there may be a week or 2 weeks or days in there where there's a lack of sleep, but it's less to do with the pathology, less to do with an illness, and more to do with the mind trying to work through some deeper subconscious issues. So don't always think about a lack of sleep as a complete disease state. Again, it's when it goes on chronically, when the lack of sleep goes on chronically and chronically and chronically, that we can really run into problems. So again, that one caveat for those of you who maybe you're not suffering with chronic sleep deprivation, but it's just picked up. And if you've got big stress going on in your life currently and you're not sleeping, you might just think deeper on that and try to process those thoughts a little bit better. Maybe you need to work with a pastor. Maybe you need to work with a psychologist to process those thoughts, or maybe you just need to work with a spouse or a loved one, somebody you trust, with those thoughts and feelings that you might be having. So don't ever underestimate the power of working through those thoughts and processing if you're having trouble or struggling through with getting sleep. So let's talk about circadian rhythm. Circadian rhythm is where we have, basically we have a hormonal pattern, and that hormonal pattern, it sets the stage for our wake and sleep cycle. So, think of it like this. In the morning time, what wakes you up? There's a hormone called cortisol, and that cortisol is stimulated by your brain when the eyes are exposed to light. And that's why the best way to wake up is to a natural light source. Some people purchase like these sun alarm clocks where it's a light that emulates the the sunlight, and it starts very dim, and then it slowly gets brighter and brighter and brighter. Actually, I have one of these and I love it. They work great. But it's a way to wake up naturally without a huge blaring alarm clock, stimulating your cortisol into super high quantities first thing in the morning. So natural light, waking up to natural light, what that natural light does is it stimulates your brain to produce cortisol, and your cortisol is what basically wakes your brain up. So it gets you active first thing in the morning. Now, over the course of the day, you should be getting exposure to sunshine. Now, many of you might wear sunglasses. You go outside, and every time you do, you're wearing sunglasses, and those sunglasses have this UV screen over them. And so some of that light, that important light that you're supposed to be getting into the retina, into the back of the eye, is not making it there because you're blocking it out. That light is important. Why? That light from the sun helps convert, or helps our brain, when it hits our eyes, helps our brain convert a hormone called serotonin. Serotonin is a happy hormone. Helps convert that happy hormone serotonin into melatonin. So over the course of the day, as we're exposed to natural light, we're building melatonin. We're converting our serotonin into melatonin, and we're building that level of melatonin up so that by the time we get to the end of the day and the sun starts to go down, that melatonin has built up enough that it can put us to sleep. That's why a lot of people use sleep aids. Like melatonin. They use these sleep aids because they're not producing their own melatonin, because several reasons. One of the big reasons, though, is they're not going outside. They're avoiding the sunshine. A lot of dermatologists in this country tell people to avoid the sun. They say, stay out of the sunlight, whatever you do, you'll get skin cancer. Or lather up in all the sunscreen, and make sure you wear hats, and make sure you wear protective eye gear. That's been overblown. People don't need that degree of protection. They don't need to avoid the sun like it's a plague. The sun is very, very critical in our health. Not only does it help us to make melatonin through the eyes, but the sun also helps us to produce vitamin D in the skin. There's some new research coming out now on sun light hitting your skin, converting the cholesterol in your skin into anti-cancer hormones, anti-cancer pre-hormones. So, different molecules that help fight cancer. So there's actually a lot of evidence showing that sunlight actually prevents cancer. Now, you can overdo it, and overdoing it means burning, right? There's something called a minimal erythemal dose, and that means burning. So you get too much UV from the sun, you actually can burn. So it's not an issue of avoiding the sun or not going outside. It's just an issue of knowing the limitations of your own skin and making sure you get what is right for your body, but not hiding behind sunglasses, not hiding behind UV-coated screens or windows, because we need that natural light to hit our eyes to convert melatonin or serotonin into melatonin so that we can get to sleep at night. So that's step one, common sense number one, is you've got to make sure that you're getting adequate sunshine on a daily basis. Now, if you live somewhere where there's no sun available, like to above 27 degrees north latitude, or maybe like Washington, Seattle, Oregon, up in Alaska, northern states or northern climates where your daylight at certain times of the year is extremely limited or reduced, I would highly recommend that you get a light box. This is one of the big tips for you is purchasing a light box allows you, basically purchasing a light box, okay, allows you to get that sunlight while you're indoors, even though it's not true sunlight. It's the same light energy that the sun produces that will tell your eyes to be able to make melatonin. So those of you who live in those northerly climates, I have some patients in Russia, some patients in Alaska. Look, take one of these light boxes, make sure that it is 10,000 LUX, luminations, 10,000 luminations or more, and make sure you sit in front of that light box every day, every morning, put it about 18 to 20 inches away from your face, sit in front of it for 20 to 30 minutes every day, and that's going to give you some production of melatonin, and it's going to in your brain. And that's what we're trying to do, is we're trying to build up enough melatonin that we can not only go to sleep at night, but that we can stay asleep, because melatonin is important to put us to sleep, but it's also important to keep us in a deep sleep. So light exposure is very, very critical. It's part of our circadian nature. We need to get light exposure every day. If you're not getting light exposure, or if you are getting light exposure but you're wearing sunglasses, or you're getting your light exposure behind a UV screen like a window or a windshield, then it's not enough. You need to roll down the window, push back the sunroof, whatever you need to do, go for a 10-minute, 15, 20-minute walk outside, keep the sunglasses and the hats off your head. again, honor the limitations of what your skin can handle in terms of the capacity of not burning your skin, but get the sunshine on your skin and get it on your skin and get it on your eyes and get it every day. It's very, very important. And if you live in a climate where you can't do that, get you a light box. You can get them on Amazon. You can get them, you can buy them online. They're going to run you anywhere in the neighborhood between $50 and $150. So you just need to get one that has 10,000 illuminations in it, and you'll be fine. Okay. What are some of the other things that people are doing to disrupt their sleep? There's some really super common things that you can do, and I'm going to show you. Let's see here. We got some new features this week that we get to show off, so I'm happy to show you. We've got some things that I'm going to put up for you. Let's see here. Okay. So here is just a general diagram that we put together on some behavior components that can inhibit sleep or healthy sleep. So this first one here is under behaviors, prayer, meditation. Now, a lot of people have a lot on their mind, and so whether it's a high stress job or a high stress relationship, their mind is revved up at night when it's time to go to sleep, and so these two elements can help put the mind in a better mindset to be able to sleep. Now, this might take practice. If you don't regularly pray and you don't regularly do any kind of meditation, don't expect to sit down and meditate and automatically all your sleep problems go away. This is like flexing a muscle. You don't work out one time and build an Arnold Schwarzenegger body. It takes practice. You've got to practice repetitively, and so the more you do it, the better you get at it, and the more beneficial it becomes. So it's just a behavior that you can have, especially if you're a type A personality or a high stress personality. Clean diet. Many of you are already following a clean diet. I've gotten a lot of your questions in already, and that's one of the questions. I'm eating a clean diet, so what is it that I need to be focused on? So let's talk about diet for just a minute. Clean diet, what does that really mean? Clean diet is not necessarily clean. You can read my book, you can go grain-free, and you can call that clean. But if you're allergic to non-grain foods, for example, let's say that you're eating broccoli and you're eating a salad every day, and that's a clean diet, right? But if you're allergic to green leaf lettuce and you're allergic to broccoli, that's not going to cut it for you. That's going to create a strong chronic inflammation. It's going to remember what happens when we make too much inflammation is it elevates our cortisol. And remember that cortisol and melatonin have an opposing action. Cortisol wakes us up and keeps us awake. Melatonin puts us to sleep and keeps us asleep. So if your food is inflaming you, then it's going to elevate your cortisol levels consistently, and that's going to keep your brain awake more frequently. So a clean diet, one man's food is another man's poison. So you may have a clean diet to your best of your knowledge, but it also may be a good idea for you to get with a good functional medicine doc and get some food allergy testing done where you can isolate and identify some potential delayed reactions. So a clean diet, again, what does that really mean? It means don't eat the obvious things. Don't eat the sugar. It means don't eat the processed foods. It means don't eat the genetically modified garbage and swill that people try to serve you. It means understanding that things like Coke and Doritos aren't good for you. Those are junk foods. It means that fast food is not healthy and it's not going to do anything for your health. So that's basic, what we would call basic common sense rules of a clean diet. But sometimes you have to dive deeper into what your diet actually is and whether it's really clean for you. Now, one of the other elements in the diet I see sometimes people struggle with is they use foods that have content of caffeine. And so, for example, if you're a big coffee drinker, especially at night, some cultures will drink espresso at night. They'll drink, heavy shots, concentrated caffeine. A lot of people are doing energy drinks throughout the day. And so that again is a source of caffeine. Some people are drinking just generalized teas, black teas, green teas, etc., with high levels of caffeine. And so caffeine is one of the biggest culprits to keeping a person awake at night. Even if you drink your caffeine in the morning, if you're struggling with sleep issues, you've got to get the caffeine out of your diet and discern whether or not it's one of those things that's overstimulating your adrenal gland and keeping you awake at night. It's very, very common for that to be the case. I mentioned before a light box, but early morning sunlight is one of the best behavioral techniques that you can use to get to start building your melatonin throughout the day. So again, getting that sunlight, the first 20 minutes of the day is a really good time to get out and get some sunshine. Journaling about your day, again, going back to prayer meditation. If you're a high stress person and and you've got a lot on your mind, sometimes writing things down and journaling can help your mind let some things go. I like to write. I personally like to write. I don't journal every day or every night, but I love to write because it helps my mind process. But I write every day, and I write for you guys. I write about research, and I write about health, and it keeps my mind processing. Otherwise, I lay there at night, and what do? I think about what I want to write about. I think about concepts. I think about biochemistry. So, whatever it goes on in your life that you're passionate about, you think about. So sometimes writing those things down can help relieve your mind of the burden of carrying them, and allows you to get to sleep a little bit better at night. Another component: do not work where you sleep. I see this a lot too in my patients. Is they sit in their bed at night and they got the laptop computer on, and they're burning late hours, and then their mind is focused on work in their bedroom, and so their mind learns. It's like a Pavlovian psychological response. Their mind learns that being in bed is when we work, and so the mind turns on. So don't work where you sleep. If you work from home, have a different location in your house where you do your work, and then when you're ready to go to bed, your bedroom is about sleeping. It's not about working, and so you need to make it as such. And then something else that can be very helpful: electronics. No electronics 2 hours before bedtime. Now, many of you have heard this. I know for some of you this is sounding a little bit redundant, but they're worth mentioning because some of you haven't heard this. So if you are scrolling through your iPad or your iPhone or your device at night, and you're getting exposed to all that blue light, and you're charging your mind with all of that distraction, right? Then what happens is you're waking your brain up before bedtime. And again, you're teaching your brain, Pavlovian response, you're teaching your brain that before bed is the time that you stimulate your brain. And so then it becomes harder for you to go to sleep. So put the electronics down. Many of you are addicted to the electronics. And I'll just say it point blank. If you find yourself and you have to be on that phone, or you have to be on that device at night, or you have to check it, or you have to keep it by your bedside, you've got an addiction problem, and you need to think really, really hard about that, and about making that better in your life, and not being quite so distracted by that device. That device, for a lot of people, runs their life, and it keeps their brains on. And if you've got that addiction, with any addiction, the first step is recognizing that it's a problem. So if you find yourself grabbing that phone or grabbing that device, or thinking about that phone or device every time it's not in your hands when you're lying in bed, or thinking about waking up and checking that device, then you've got an addiction problem with that device, and you need to get some help, and you need to figure that out. Sound therapy is another great way. Sound therapy, some people like to listen to soft, soothing sounds. Again, this varies from person to person, but I personally like classical music, Beethoven and Bach and some of the great producers. But some people like the sound of rain. Some people like the sound of water running. Some people like the sound of a rainstorm. Some people like the sound of birds chirping, or whatever it is that for you calms your mind and relaxes your mind. But sound therapy can also be quite helpful for many people who are struggling with sleep. Some other types of things that can be done. Essential oils is probably one of the most effective and least invasive and least side effect inducing way from a supplemental perspective to help get the mind and the body ready for sleep. One of my favorites on that front is lavender. Is just to take a little bit of lavender and rub it on the back of the neck, or put a little bit on the pillow, and then from there it can kind of help calm and relax the mind. Magnesium also works extremely well. Now, there's different forms of magnesium. You'll see here in this diagram, I've got something called Clear Mag, something called Ultra Mag or Ultra MG. And Clear Mag is a specialized type of magnesium called magnesium threonate. And magnesium threonate passes the blood-brain barrier. It's a special type of magnesium that can get into the brain, and so it can help get into the brain and relax the brain. Now, some people who take Clear Mag or magnesium threonate have a very, very, very deep and vivid sleep. Almost like, I like to call it ninja dreams, where they go into such a deep sleep, they have dreams that seem to be extremely real and very vivid. And if it's a nightmare, that can be kind of scary. So know that can be a potential side effect of magnesium threonate. So just be prepared to have very, very vivid dreams as a potential for side effect. It's always better on that particular type of magnesium to start at a lower dose. Only start at 100 milligrams and work your way up. Start at 100 milligrams for a few days, work it to 2, and if you need it, work it to 3, and potentially even up to 4. If you're having to go more than that to get sleep from magnesium threonate, it's not going to work for you. Don't keep pushing the dose. Other forms of magnesium, there's magnesium citrate and glycinate and gluconate. There's all different types of chelated forms of magnesium, and for some people that works really well. For some people, taking an Epsom salt bath. Epsom salts are magnesium, so soaking in magnesium to relax the muscles and to relax the body can be very, very effective. A warm bath. Again, these are just lifestyle strategies before bed preparation, if you will. And then there are some other strategies, and these are more pharmaceutical, and they're natural pharmaceutical strategies as opposed to prescriptive drugs. So things like chamomile, you can do a chamomile tea. Valerian, you can do valerian teas, and you can do valerian herbs, encapsulated herbs and things of that nature. These are calming. These are muscle relaxing herbs that can also calm the mind. Some people use GABA. It's very helpful. Some people use theanine. It can be very helpful. Some people use something called 5-HTP, 5-hydroxytryptophan. Now, why? 5-hydroxytryptophan is a precursor to serotonin, and serotonin helps make melatonin. Some people are serotonin deficient, and 5-HTP can help build the serotonin levels so that you have enough serotonin to produce melatonin, and that's why it's used as a sleep aid for many people. And then melatonin. And melatonin is one I don't recommend that you just blindly use just because. This is one of those things when you find that all these behavioral changes haven't helped you and haven't worked for you, now you might consider a melatonin if you're really sleep deprived. But melatonin use long term, I don't really recommend it. It's better used if you're a traveler and you're going from one time zone to another. So your circadian rhythm's a little confused, because especially if like you're a transatlantic traveler where you're going into, an 8-hour difference of a time zone, that in and of itself, taking melatonin before the bedtime in the time zone that you're at can help you reset your circadian clock and get your sleep more regulated. So if you're a traveler in your job and you find yourself traveling, from the west to the east coast, or, over the ocean, over the pond, taking melatonin before the bedtime, an hour before the bedtime of the time zone, can help reset your circadian clock. But again, it's not something I would recommend that you use, on a super, super regular basis. Okay. So here we are back, right? So those are, again, just some strategies on what you can do for getting sleep in your day-to-day life. Now I want to talk a little bit about some new research that's come to light, and so I'm going to share something else with you here. This is coming from a new study that came in here recently on something called SIBO, and you're going to ask me, what does this have to do with sleep? But just stay with me. I'm going to get to my point. This was a study, and I'm just going to read you the abstract here. The levothyroxine, which is thyroid medication, which is one of the most commonly prescribed medications. Levothyroxine therapy and impaired clearance are the strongest contributors to small intestinal bacterial overgrowth, meaning that basically this particular medication can cause a bacterial overgrowth in the GI tract. Let me show you that, because it didn't share with you. Hang on just a second. Be patient with me. I'm learning this new technology to help these pick your brain sessions get better and better for you. So here we go. So again, this is the science update. The levothyroxine therapy and impaired clearance are the strongest contributors to SIBO, small intestinal bacterial overgrowth. Okay, so this is a study where what they did was they were studying, what were the biggest causes of SIBO. Again, I'm going to get to why this is important for sleep. So the most important contributors for the development of SIBO in ascending order are immunosuppression, meaning drugs that suppress the immune system like steroids. And many of you with chronic illness are taking some kind of steroid like a prednisone or a corticosteroid, or some type of immunosuppressant for autoimmune disease like an Enbrel, right? Impairment of intestinal clearance. So this is something that maybe causes constipation, right? That's any drug that impairs intestinal clearance. So some of the more common things that cause this are your acid-reducing medications like PPIs, proton pump inhibitors, histamine antagonists, H2 antagonists. These are drugs like Nexium and Prilosec and Protonix and Zantac and Tagamet, and even Tums and Rolaids, right? They block stomach acid and they slow down intestinal clearance because you need that acid. That acid stimulates peristalsis in your GI tract. Other things that impair intestinal clearance is eating too fast, being under too much stress and eating too fast. That in and of itself can create a problem, and it has nothing to do with drugs. But and then the other is levothyroxine. So again, this is if you have an autoimmune thyroid condition, your doctor has given you Synthroid or levothyroxine as a drug, or if you've got another kind of autoimmune disease and you're on a steroid or you're on some kind of immunosuppressant, this contributes to SIBO. Now, okay, I'm going to go back to the regular screen here. After showing you that, what I want you to understand is if you are causing SIBO, if you have a bacterial overgrowth in your small intestine, I want you to understand that part of what your microbiome does is your microbiome creates neurotransmitters. About 90% of your serotonin is in part produced in your gut through the action of bacteria. So if we imbalance that bacteria, we are going to alter our serotonin levels to a point where it can create melatonin production problems. So again, SIBO, a lot of people that suffer with SIBO symptoms, which typically there are a lot of symptoms of SIBO, but the gas, the bloating, the acne, digestive disruption, those are some of the big symptoms. But one of the bigger ones that people don't talk about is sleep apnea or sleep disruption, not being able to fall asleep, not being able to get to sleep. And a lot of these people also have restless legs, meaning that the bacterial imbalance creates a restless leg syndrome and that's part of the sleep disruption. Is the legs are jumpy at night, the mind is jumpy, the legs are jumpy, and this has to do with the microbiome's capacity to produce neurotransmitters that aid your brain's production and conversion of serotonin to melatonin. So if you're on any of those medications and you're struggling with sleep, and you've tried all of those other tips that we talked about, you've got to have a meaningful conversation with your prescribing doctor about other potential options so that you are not subjecting yourself to that. Now, the authors of that study did not say why levothyroxine was a cause. In other words, they found that statistically people on levothyroxine had higher levels of SIBO, but they did not ascertain as to the origin or mechanism. My thought is this. This is just one of many thoughts, but one of my thoughts is that the levothyroxine has GMO corn filler in it. Again, that corn, if you're grain sensitive, if you're gluten sensitive, can be a cause of gut dysbiosis. And so maybe it isn't the medication itself, maybe it's the filler that's in the medication. I have seen this be the case. That's why I even have that theory. It's because I've seen patients who were on that medication for their thyroid conditions, and in order to get better and be able to fall asleep, I've seen them have to get their medicines compounded without the corn filler. And once that happens and we get them off that filler with the potential for GMO corn and the gluten component, as well as the potential for the GMO element, which is glyphosate, creating gut dysbiosis and potential for sleep disruption. Again, this is my theory on it. I'm just giving you access into some of the thoughts that I have based on some of the patients and some of the clinical people that I've worked with. That is one of the things I have seen be a major contributor. So I wanted to show you that today because a lot of people don't think about that. They don't think about those kinds of things. They're on medications, and usually, very rarely do people go from being on a medication then to not being on the medication. Usually they're on a medication, then more symptoms develop, and then their doctor recommends more medications, and then it becomes a build on top of process, right? You're medicated for one thing, then the symptoms from the medicine comes on. And then they're medicating you now for the next thing, right? Now they're medicating you for the gas and bloating, or for the reflux, they're giving you a proton pump inhibitor, and now that's also causing SIBO. So you get into these vicious, what I like to call vicious, prescription pain traps, where the one drug is treating the symptom from the other drug. And when does it end? It ends when you reverse engineer the process and you figure out where the problem is coming from and quit trying to mask it. So wanted to bring that to light. Now let's talk about getting your questions answered. So I've got a ton of questions coming in. So here's one from Sheila. Let's just show it up on the screen. Sheila's asking, why do I fall asleep easily, and then an hour and a half later I'm wide awake, and so it goes throughout the night. So falling asleep is easy, but waking up periodically throughout the night comes. This usually this is a melatonin buildup problem. You have a problem with getting adequate melatonin produced because you have enough melatonin to put your brain to sleep, but you don't have enough melatonin to keep your brain asleep. And so understand that the biochemical process of melatonin creation requires certain nutrients. So what I see oftentimes, people are deficient in vitamin B12, they're deficient in magnesium, they're deficient in zinc. And so even maybe they're already getting plenty of sun, but even with that sun, they can't produce the melatonin because they don't have the precursor cofactors, which are those vitamins and minerals, to be able to produce adequate melatonin. So have your doctor check for those nutritional deficiencies, and it might solve your problem. Again, going back to what I said earlier, sometimes people wake up because their brain is trying to subconsciously process as well. So you might just explore that psychological component. If you've got some stress or some points in your life that are really bothering you, you might consider talking to somebody you trust and love and working your way through those thoughts and seeing if that doesn't help as well. But great question. Okay. Linda is chiming in. Excellent sleep hygiene, good on food sensitivities, true gluten and grain-free, on WP, I'm going to assume that's WP thyroid, and LDN, low-dose naltrexone, which is a drug used for many for autoimmune disease, for thyroid and Hashimoto's. I'm dialed in with nutrient deficiencies, eat an organic, clean diet, exercise and movement in Goldilocks zone, meditate, relax, good relationships. I used to sleep so well until the last 10 years. I worked in my adrenals and sex hormones. I'm not sure I understand that. Worked in my adrenals and sex hormones with a FM doc. I'm going to assume that means that I've worked on those things with a functional medicine doctor. I have Lyme and co-infections, and I'm working on that with a doctor using Chinese protocols. Lab work looks good. No one can figure out the next steps. Wow. Linda, that's a big mouthful, right? Or that's a lot. If you've been truly diagnosed with Lyme, that could be part of the problem. What I would suggest that, again, I don't know if it's been done yet or not, but this is a very advanced strategy for people with Lyme. One of the problems with people with Lyme disease is their immune system is so busy trying to combat the Lyme that it can't combat other things in the environment. So people with Lyme tend to develop a condition called MARCONS, MARCONS. MARCONS is, and let me put that in for you. MARCONS stands for multiple antibiotic resistant coagulase negative staphylococcus. It's a type of bacterial infection, and it can get inside the sinus cavities. Again, this is very common as a co-infection with Lyme. And what MARCONS does is the bacteria produce endotoxins that generate an inflammatory cascade in the brain, because your nose has direct action tie into your brain. And it can alter a hormone called MSH. That hormone, MSH, is melanocyte stimulating hormone. Now, MSH, it will lower that hormone. And so having your doctor maybe check for that MSH if it's lower, and doing a nasal culture to identify or rule out the potential for MARCONS. Now, some other things they can measure with you aside from MSH, because this will disrupt your sleep. When your MSH levels drop, you're not going to sleep very well. It's part of the process of its chemical inflammatory cascade. But your doctor can measure your MSH. They can measure a chemical in your blood called transforming growth factor beta 1, or TGF-B1, which is another marker. And if that hormone is really high, then that's a potential that the inflammation coming from the infection is in part triggering this problem. And yet they can also measure another compound called C4A, complement 4A. And if that's high, that's something, those markers can be monitored for success of effectiveness of the treatment protocol. So if you're being treated for Lyme and you're being treated for other kind of co-infections, that looking at those things would be an important next step. So again, that's what I would recommend. It's an advanced strategy, but find you a doctor if you don't already have one. It sounds like you might be in pretty good hands, but find somebody who's willing to do those things for you as the next step or the next level of investigation. Okay. Rochelle, my boyfriend has a hard time falling asleep. It takes him hours to finally fall asleep. He is gluten-free and has tried being grain-free and dairy-free, but it hasn't helped. Any suggestions besides turning off the TV early and changing the light in the house? Thanks. Yeah, I mean, lots of suggestions. I mean, there are a number of reasons why he might be having trouble falling asleep, but, one of the issues might be his airway is clogged. And so, having some recognition into that. A lot of people have chronic sinusitis, meaning they have an infection. I mentioned MARCONS earlier, but yeast overgrowth can occur in the sinuses and swell the turbinates and make it hard to breathe. And so it can be really hard to fall asleep when we're not getting adequate oxygen. The brain will stimulate a stress response when there's not enough oxygen coming through. That's why people have sleep apnea when they're lying on their back and snoring. There's lack of oxygen getting in. That's why they wake up. their brain wakes them up because there's this fear that there's going to be an oxygen deprivation that can, that can put you out. So that would be one element, would be to look for that. The other thing would be exercise. A lot of people struggle with going to sleep at night because, especially this is true for men, because men are physical creatures. Women are emotional creatures. Men are physical beings. And so men have to, it's like women have to verbalize, I can't remember what it is. I think it's like 50,000 words a day, right? That they have to expend that emotional, mental energy through speaking and communication. Men can say 10 words a day and they're fine and they're perfectly happy, but men need to expend physical effort and exertion. And so if they don't have any means or output, it's going to create struggles in their ability to fall asleep. So if you're a man and you're struggling and you're not capable of falling asleep, one of the things that I would highly suggest or highly recommend that you do is high intensity interval training. So what is that? What high intensity interval training? It's push-ups, pull-ups, squats, lunges, sit-ups, jump ropes, burpees, body weight activity with really high intensity for short bursts. So doing something like this earlier in the day can expend the physical energy that a man needs to expend in order to prepare them to be able to fall asleep at night. So you remember, if we go back in time, most men worked physical labor. They worked physical jobs. Today it's desks. Men are sitting in air-conditioned rooms, pounding down a keyboard all day long, using the emotional energy and using the mental energy, but not using the physical energy that they require to expend in order to be healthy. So a man needs to be able to use something to get that high-intensity interval training or interval activity in. Punching bags work really, really well. 10 minutes of really intense, interval sprinting. Again, burpees are a great exercise. A burpee, if you don't know what that is, it's like a combination between a jumping jack and a push-up. You jump to the floor, push up out, and then jump up and do a jumping jack, and then go right back down to the floor and do that repetitively. If you do 15 or 20 of those, you're going to be, gasping for air. It's a great way to expend physical energy in a short burst type of atmosphere for a man. And I find, personally speaking, as a man, if I don't get in my high intensity interval workout, I do struggle with my sleep at night. It's a lot harder for me to fall asleep. So you might have your boyfriend try that technique and see if that doesn't help him. Let's see here. What does it mean if you cannot take 5-HTP, 5-hydroxytryptophan? It gives me immediate insomnia. So you're having a paradoxical effect. It means you're having a conversion issue. You're not capable of converting serotonin into melatonin, and the serotonin is keeping your brain happy and awake. So it's the wrong supplement. One of the things that happens, one of the nutrients that's necessary to convert 5-HTP into serotonin and then from serotonin to melatonin is vitamin B6. So it's very possible, Lulu, that you have a vitamin B6 deficiency, and that's the reason why you're getting this paradoxical reaction when you take 5-HTP. A really good 5-HTP product will have vitamin B6 in it. Anybody who's doing any kind of formulation, biochemically should know that. You put those two nutrients together, you don't take them separately, at least not for sleep. So mixing that vitamin B6, which is also known as pyridoxine, and the most bioavailable form of pyridoxine or vitamin B6 is pyridoxal 5-phosphate. So that's what you're looking for on the label. And I know that's a mouthful, so let me give you the spelling of that. That's pyridoxal 5'-phosphate is the active ingredient for vitamin B6. So if you're looking for a high-quality B6, you're looking for that on the label. And mixing that with 5-HTP, and that might give you a better result. So hopefully try that out and let me know in the next segment whether or not that was helpful for you. Okay. Let's see here. Another question. My hormones still aren't back to normal since my pregnancy, and it's been 8 months. The brown spots on my face are out of control. I'm grain-free and eat superfoods. Let's see if we can find the question in that. So you're struggling with finding some type of hormonal imbalance or hormonal balance after hormonal imbalance after pregnancy, being grain-free and eating. I don't know what eating superfoods means, and I want to clarify. Kayla, I don't mean to pick on you here, but I just want to clarify something. And I think this is worth typing in. because I get tired of hearing this. Okay, there's no such thing as a superfood. I don't even know what that means. You hear people talking about superfoods all the time. Every food is super if it's real food, if you're not allergic to it or you don't have a problem with that food. So if the food is produced, if the food is produced naturally without chemicals, without processing, it is a superfood by all its right. It has super ingredients. It has wonderful ingredients. But we don't want to categorize certain groups of food into superfood category because it alienates other foods. It's kind of like people. We don't want to classify certain people into super groups of people and then alienate other people because they haven't found their superpower yet. Everyone has a superpower. Every food has a superpower. It just because a food is being labeled super out in the lay press doesn't mean that it's super. It just means that that some scientist somewhere has discovered a really nice ingredient in that food that's been really helpful for some form of human chemical physiology. But again, that's just the horse. I mean, let me get off that horse now. Superfoods are fine. Blueberries considered a superfood or whatever. But get away from that thought process of superfoods and get more on the thought process of eating real food, eating healthy, real food that's not processed with chemicals, additives, preservatives, and properly prepared based on the individual's ability to tolerate the food. So going again back to that, I think that's an important thing that I wanted to get that out there. So now let's get back to your question, which is my hormones aren't back to normal after pregnancy. Here is the number one thing that happens after pregnancy, especially if you went through pregnancy and you're breastfeeding. The number one thing that happens is you are feeding for two, right? So the little baby parasite that's living in your body is just sucking you dry of vitamins and minerals and amino acids and fats. And your body is giving to that baby more than to you because that baby is the priority. And so after pregnancy, after that baby is born, you're in a deficit state. Like your body is in a deficit state, yet you still have to repair and recover, and you still have to have an adequate amount of nutrition to breastfeed. And you're still giving a lot of your nutrients to the baby through breast milk if you're breastfeeding. So some of the worst nutritional deficit cases I've seen in practice in 16 years is women postpartum. We run lab testing to determine their nutritional deficiencies. At one time I had a woman, she had 27 nutritional deficiencies postpartum. And her hormones were all over the map. And they were all over the map because she didn't have the vitamins and minerals necessary to produce the hormones. Last week I talked about thyroid, and I walked through the entire biochemical cascade of how your body produces thyroid hormone and which vitamins and minerals you need. We could do the same thing with estrogen and progesterone, and we could do the same thing with testosterone and DHEA and pregnenolone and all the other hormones that the body produces and needs to regulate itself. All those hormones require nutrients. And so if you're malnourished after pregnancy, then the number one thing you can do is to have your doctor look at your nutritional status in a very meaningful and comprehensive way and get you supplemented so that he can start getting you corrected on nutrition. That's number one. That is the very first thing that I would have you do first and foremost, because the likelihood that will clear everything up for you is very, very high. And in my experience, it's number one needle mover in that scenario. Okay. Happy Friday, Dr. Osborne from Phillips Ranch, California. Hi. Happy Friday to you too. Thanks for chiming in. Another question's coming in. What about L-theanine? I mentioned L-theanine before. L-theanine is kind of a calming agent. It's an amino acid that can help calm down the brain. It can work as a sleep aid, but again, I don't recommend it for long-term use. It can be used in the short term, but again, ascertaining the underlying reason as to why the sleep brain fart, why the sleep problems are there in the first place is important. Andrea is chiming in with a big hello. Hello, Andrea. Thanks for joining us. Okay, here's a question. I used 50 milligrams of niacin and frankincense with coconut oil on the bottom of the feet, back of neck, and was able to stop psych meds. My psychiatrist now shares this with his clients. Hey, that's awesome. That's great. Let's talk about why that works. Glad you chimed in on that. What is niacin? Niacin is vitamin B3, and its other name is nicotinic acid. So you might have heard, it being said different ways, but nicotinic acid, niacin, or vitamin B3. Vitamin B3 deficiency causes neurotransmitter imbalance in the brain. Actually, one of the symptoms of vitamin B3 deficiency is a disease state called pellagra, Pellagra. Pellagra, it manifests several different ways. It actually manifests a lot in the same way that gluten sensitivity manifests. The symptoms of pellagra are diarrhea, dementia, or losing your mind, brain fog, clouded sensorium, right? We can get diarrhea, we can get dementia with it. And so again, going back to, what you were taking it for, which is getting off of your psych meds, because niacin is necessary to form neurotransmitters. You've got to have niacin to break down some of the intermediate byproducts. Actually, one of the most intelligent and one of the most profound leaders in the nutritional functional medicine movement, at least in my humble opinion, is Dr. Abram Hoffer. Now, Dr. Abram Hoffer, he was a psychiatrist. He's since passed away, but he's one of the brightest minds in the world in this realm. He did studies on patients using high doses of vitamin C and niacin. Now, he was a psychiatrist, so he was treating psych patients with schizophrenia and bipolar disease. And his theory was something called the adrenochrome theory. Now, adrenochrome is a byproduct. It's an intermediary byproduct of neurotransmitters in the brain. And some people don't break down adrenochrome, which is a byproduct of adrenaline. And so what adrenochrome does is it builds up in the brain and it creates hallucinogens and it creates neuronal disruption in the brain. And so you need vitamin C and niacin to break down this adrenochrome molecule. And he actually tested this theory on himself, him and another Dr. Oswald. They tested this theory on themselves and proved it, and then proved it repetitively in clinical trials with their patients. So this is one of the reasons why that worked. Niacin is one of the most powerful medications that, even though it's a vitamin, that a person with psychiatric diseases can use to overcome needing psychiatric medications. Although when you do that, you want to do that under the guidance of a qualified doctor, and don't just do it alone. Because if you've been on psych meds for a long time, there can be some pretty severe side effects as a result of cold turkeying those types of medications. But super glad you chimed in with that and with that experience, because that will probably help somebody else. So thank you for that. Okay. What are your thoughts about a grounding sheet for improved sleep? Love it. What I like even more than a grounding sheet is this right here, something called a beamer. And a beamer, what a beamer is it's a type of PEMF. PEMF stands for pulsed electromagnetic frequency. And a beamer is much more effective actually than a grounding sheet, although a grounding sheet is a lot more cost effective. A grounding sheet is just a sheet you can put on the bed and it grounds generally to an outlet. And so it allows for the Earth's electrical magnetic properties to pass through your body while you're sleeping, because when you're on a bed elevated, you're not really getting that. So some people do really, really well with electromagnetic field from the Earth being a part of their electromagnetic field. And there's a lot of really new and emerging science on this topic. And so it's a really great idea if you're struggling. But I like actually using the pulsed therapies themselves. Biomats, there are different mats that actually emit pulsed frequencies, electromagnetic frequencies, that can help. What they do is they help increase the microcirculation, the tiny blood vessels, the microcirculatory elements. And so it increases oxygen and it increases blood flow. And anytime you can increase blood flow, you can improve outcomes. I mean, it's not even necessarily, it's not a treatment, it's just improvement of blood flow. A lot of people suffer from lack of blood flow, whether it's because of muscle spasm, whether it's because of lack of strength or lack of exercise, or whether it's because of lack of oxygen because they're not breathing in adequate oxygen because they have anemias, or because they have other types of nutritional problems that make it hard to deliver oxygen, and then their blood flow is not as effective. The PEMF device can increase that and can improve upon that. So one of the best ways to ground, beyond the grounding sheet, a more advanced way to do that is through pulse electromagnetic frequency therapies. And the machine I recommend, I actually have one, is called a beamer. Okay. Okay, so here's a second follow-up on, I think, on the question we had before. My boyfriend doesn't fall asleep as his mind is busy, and when he does, he nightmares. He has nightmares, bad dreams of being harmed, hurt, or in distress. Never had any trauma to cause this, and his life is quite stable. He doesn't have sleep apnea, doesn't snore. His bad dreams indicate stress, but even massage, etc., doesn't help. His work up and down ladders. About exercise, obviously, for that in this situation might not really apply to him. If he's having nightmares like that, he's got something going on, and maybe he hasn't been forthright. Now, I don't want to call him a liar, and I don't want to call you uninformed. But if he's having nightmares and he's waking up every night with dreams that he's being harmed, there's probably something internal that he's struggling with, and maybe exploring that. Again, a psychologist or even with you or somebody he loves and trusts that can help him get to the bottom of that. There's something emotional going on there. Even though he might on the outward appear to be stable and not in any arduous stress, that would be what I would explore. I would say that would be one of the bigger things to explore, because he's outside, he's getting exercise, and he's doing a lot of the fundamental things. So the other thing I would explore is diet and nutrition. So these are just other strategies. One thing that can cause nightmares and bad dreams when we have no past history of trauma or we're really not working through something is vitamin B1 deficiency, thiamine. Thiamine deficiency can cause nightmares. It's very well documented that nutritional deficit can create that. So you might want to have that as another thing to explore. So hopefully that will help you out, and try that as well. Here's another follow-up. As a follow-up, I also have a paradoxical effect to melatonin, wide awake, nothing on my mind. You probably have histamine intolerance, and you probably have high histamine levels in the brain. If you're experiencing a paradoxical effect to melatonin, that would be one of my thoughts. You're in a lot of nerve pain, have fibro and polymyalgia. Unfortunately, I take Medrol. Well, you're taking an immune suppressant. Medrol dose pack is a steroid. Trying to get off of my body goes on fire. Sheila, you need to work with a doctor. This is a little bit more complex than probably what we can address in really enough great detail to get you in the right direction. I would highly suggest you find yourself a good functional medicine doctor to work with. Because if you're not sleeping, you're not healing. And with fibromyalgia and polymyalgia, which both of those, depending on whether your diagnosis is even accurate, fibromyalgia is a sensory processing disorder of the brain. Polymyalgia is an autoimmune disorder of the muscles. They're not the same thing, and maybe you have them both, and maybe you have one, and maybe you have the other. But I honestly, I would get with a functional medicine doctor and get some real answers with some advanced testing, because if you're struggling, I don't think you're going to find an answer with trying to take melatonin or any other kind of sleep aid. Question coming in. Hi, Dr. Osborne. Hi, Carolina. Is it okay to take melatonin long-term, 3 milligrams? I would say it's better to approach it from a lifestyle perspective and try to wean off of the melatonin. Is it safe? There's not really any long-term studies that show that it's damaging. However, one of the things that we suspect is happening with long-term melatonin use is that, just like with long-term steroid use, or any long-term hormone use, you actually impair the organ that makes that hormone naturally. And so when you try to get off of it, you can have a rebound effect. And, the bigger issue is what's causing the problem with the sleep. And so I would say long-term, no, it's not something that I would say, let's recommend it long-term. Short-term, yes, let's get you some sleep. Let's get you feeling better, but then let's dive in a little bit deeper. Okay. Another question. Lori's asking, hello, Dr. Osborne. Hi, Lori. I just logged in. So sorry if you already answered this. I wake up most nights after 4 hours of sleep or less. I never sleep more than 4 hours. My husband thinks I have sleep apnea, but I don't sleep. Could it be possible to have sleep apnea? Well, sure, it could be. And you could do a sleep study and that would be fine. But, what I would suggest is, if you're waking up after only 4 hours of sleep, what I would suggest is to run a neurotransmitter test, what's called a sleep panel, where you're measuring your histamine and your melatonin and your serotonin and some of the glutamate and GABA and some of the other neurotransmitters that are important in the regulation and circadian rhythms of sleep. And also have your circadian cortisol rhythms checked by a doctor. And 4 points of the day, not just one cortisol reading out of the blood, but you want 4 readings. You want it in the morning, you want it again in the midday, you want it again in the kind of closer to the evening around 4, and then you want it again at night before bedtime. Have those checked, and you'll kind of see if there's an abnormal hormone pattern, then you can kind of reverse engineer why that exists. And that's what I would suggest that you do first, along with testing your nutritional status, because again, if you do have a hormone imbalance or a hormonal pattern that's abnormal, just solving nutritional deficiencies a lot of times solves hormone imbalances. Okay, Val is asking, can you repeat the spell the type of magnesium that goes past the blood-brain barrier? Sure. That is called magnesium threonate. And there's the spelling. Magnesium threonate is the type of magnesium that has been shown to pass the blood-brain barrier. So there you go. Okay. All right, let's see here. Could I type in the term you used on the system condition niacin worked? I used at bedtime and fell asleep in 20 minutes, was being treated for PTSD, fibromyalgia. I'm not quite sure I understand the question. The term I used on the system, so niacin works in the brain to help process a chemical called adrenochrome, and there's the spelling of that. But if you really want to read more about this in great detail, what I would suggest is look up, there's a book called Adventures in Psychiatry. I actually have it on the shelf right here behind me. It's one of my favorite books. And that's Abram Hoffer is the author, and he again was a medical doctor, psychiatrist who did a lot of the early research on vitamin therapies in psychiatric disease, and you'll love his work. He's again one of the brightest minds. And again, coming from me, I don't say that often, but he was one of the brightest minds that we've ever had in the field of biochemistry. Okay. Elaine is chiming in. This may be helpful because for one of our past questions. My nightmare stopped once I started using a grounding sheet. It was strange since that wasn't on the list of things that it was supposed to help. They came back once when the grounding rod became disconnected from the cord. Interesting. So for those of you listening in, Elaine's experience was nightmares went away with a grounding sheet. Thanks for sharing, Elaine. Kim Johnson, hi there. I get tired around 10 p.m. when I go to bed. I seem to wake up and then can't fall asleep for hours. Lots of reasons why that can happen, but typically it's a cortisol imbalance. Your adrenal glands are confused. And so one of the best things to unconfuse your adrenal glands, you're producing too much cortisol at night and you're producing too little cortisol during the day. That's typically what happens here, is to get that sunshine, get that morning sunshine to help reset your circadian rhythm. So go back and listen to the first 20 minutes of what we talked about, Kim, and that will be real helpful for you. Let's see here. Looks like I'm out of questions. Well, we're about out of time too. So this was a great segment. Now, last week I said that we were going to be giving away some prizes, and we're not giving away any prizes because nobody sent me in. They're shared. I told you what the rules were. I said you send me your screen share of you sharing and liking and spreading that thyroid video to your friends on Facebook, and nobody sent that in. So I'm going to give y'all another opportunity. Y'all, that's a Texas word. I'm going to give you another opportunity to win. We're going to give away the same prizes, but if you want to enter for the prizes, you've got to you've got to share this video. You've got to share it with different groups that you're in on Facebook who might benefit from it. So if you're involved in a sleep apnea group, if you're involved in other groups, get this word out there. Don't be stingy with the knowledge and the information I share with you so you can share with others. And I reward you when you share with others. So send me those screenshots of your shares. We're going to take the one who shares it the most and the one who distributes that information to as many people as possible. And that's who we're going to pick from the winners. And we will announce those winners next week. but you've got to send those in to us. Let me give you the email address to send them into, glutenology@gmail.com. Remember, we're going to be doing these giveaways every week, but I can't give it away if you guys don't participate. So I need your participation. This is a mutually participation required event. And so send those screenshots into glutenology@gmail. We will pick the winners on based on who shares the most, and we will announce those winners next week. I've got another great topic for you next week. So if you are looking for the topic from last week online, those of you who do not subscribe to our YouTube channel, what I want you to do is go to, let me put that link in here for you. Here you go. Go to youtube.com, user Glutenology. That's my YouTube channel, Glutenology. We post the replays right there on that channel, so you can go and watch the last week's replay, the thyroid function video, and you can watch that. It's up there. It's ready for you to tap into. So feel free to subscribe to our YouTube channel. That way you get notified when new videos come in. Yeah, subscribe. So anyway, there's the link or the URL for you. I'm going to also post it in the Facebook feed, and there you go. That's there. It's a live link, so you can just click on it and get on over there. But okay, we're going to wrap it up. You guys have a wonderful weekend. Super happy you spent some time with me on your Friday. We'll be back next week for Pick Dr. Osborne's Brain topic forthcoming. And if you've got topic requests, you make sure that you also email those into glutenology@gmail.com. We're going to entertain you. So, you know, we're going to cater our message to what you guys need to hear, what you want to hear, and what you need to hear the most of. So have a great weekend. We'll see you next week on Pick Your Dr. Osborne's Brain. Have a great, great weekend. Take care.